Welcome to Doctors of the Bay. On today's episode, get ready to be inspired by today's guest, Dr. Nnamdi Ndubuka. He's currently serving as the Medical Health Officer with the Northern Intertribal Health Authority in Prince Albert, Saskatchewan, and he brings over a decade, if not more, of expertise in public health, social determinants of health, and infectious disease epidemiology. As an associate professor with the University of Saskatchewan, he's also shaping the future of healthcare education and policy. He's also the newly elected president of the Black Physicians of Canada. So this is a conversation that you don't want to miss. Dr. Nnamdi Ndubuka, thank you for joining us on Doctors of the Bay, Bob. You're welcome.
Thank you. Thank you so much for the kind introduction, Dr. Makunda Stevenson. I really appreciate it, and thanks for having me today.
Wonderful. Now, for people that don't know, and you and I actually met many years back.
Thank you. Thank you so much once again. Yeah, so my journey actually started back in Nigeria. I was born into a family of 5. I have 4 other siblings. Just like the traditional Nigerian parenting style, our family was very fortunate to, instill that discipline in us. We had the opportunity to experience that, tough love, and also imbibed the family values that included, respect for traditional institutions and instilling in us a sense of responsibility. Growing up within those confines of our culture, it actually helped us to become who we are today, and is also shaping us. For me, particularly, I was told that you're going to be a physician straight ahead. There was no argument. That's the Nigerian parenting style. So when you get to the stage where you choose a career, you don't have a choice, right? So I have an older sister. We were told at the same time that you're going to be a physician, you're going to be a microbiologist, and that was it. So there was no room for negotiation. And that was how my medical journey started back in Nigeria. And from there, of course, it wasn't easy going through medical school with all the challenges to, emerge successful from school. And of course, we know the typical Nigerian system has its own unique challenges as well in terms of the duration you spend in school before graduating. But fast forwarding, after graduation as a family physician, which back home it's known as the general practitioner, which I had the opportunity to, leave the country to go to Botswana. At the time when Botswana had very high prevalence of HIV, second to Swaziland in terms of prevalence. And it was really an honor for me because it provided me the opportunity to work with the Botswana government and the Harvard School of Public Health to support the response to HIV. And as part of that journey, it also gave me the opportunity to participate in training physicians, training nurses, and began to see other aspects of healthcare beyond just providing patient care within the primary healthcare setting. So that's where I kind of developed interest to say, okay, I think I need to pursue additional studies, having in mind that I wanted to do something beyond family practice, but looking at population health. And that was the desire that I had that made me start thinking about public health. And of course, in Botswana, very close to South Africa, I felt South Africa was a place to, pursue those studies at the University of South Africa in Pretoria. And that was how the journey to public health actually started. And since then, it's been amazing.
But I'm wondering, just to go back to that period and looking back now, was it a good decision that your parents made on your behalf?
I would say yes, it was a good decision at the time, because I wouldn't know for sure if I would have chosen to be a physician if left alone. our parents, most times they see who we are, they know our strengths, they know our areas of improvement, and they can tell us that this is what they think, strongly encourage us to do that. But unfortunately, it wasn't that way for us. Although now in our own parenting style, we try to persuade our kids, we try to let them know that this is what we think, and we encourage them to take step towards that. So we give them the opportunity to also have a say in the conversation, right? Looking back, I think becoming a physician, and most importantly, a public health practitioner, has actually enabled me fulfill my aspirations and my purpose in life. So I would say, with a lot of gratitude to my parents, that they actually made the right decision for me to study medicine. It has shaped me in terms of who I am today, the resilience, the responsibility, the values around, mutual respect for humanity, and most importantly, trying to impact life on a global level. I think that is the foundation. So I remain very grateful for them for that decision that they made.
Yeah. And so finding yourself now in medical school, how were you able to navigate all the challenges? What did you draw on to make that, or to facilitate your studies and make it easier for you to complete without resenting your parents?
Yeah, I think the one thing that I will say is my faith. I think we have a lot of emphasis on spirituality, and then drawing on our faith, in the sense that we believe that God, who has created us, and we believe in Him, He instills in us the grace and the strength to achieve our purpose in life. That is one. And then number two, again, through medical school, I think we had the privilege to have people who looked onto us, our mentors, people who are way ahead of our journey, that we really drew inspiration from. Even during our low moments, we can write a quiz and you didn't do too good, and you're asking yourself, how are you going to make this up before it starts impacting your grade? Thank goodness there were those individuals in med school at the days that actually helped us to get some kind of support system in place that enabled us to overcome those stressful moments. When I look at the medical institutions, like medical learning institutions today here in Canada, and what we had back home, there are stark differences. And I can say that our system back home, though it was not optimal in terms of the resources needed to become well-trained physicians, in terms of the, say, resources for learning and even opportunities to go to other programs or rotation elsewhere. But because we are subject to studying in difficult conditions on our own, I think that also has contributed to what we bring to the table today and around the world where we are. Because if maybe we had all that we needed, perhaps we couldn't have developed that resilience or hard work to succeed, which also reflects other areas of our lives beyond medicine.
That's really great advice, especially for people that are still working in very challenging systems in Africa and other under-resourced parts of the world. I'm still intrigued by your attitude when you found yourself studying medicine. I'll say encouraged, maybe strongly encouraged by your parents. Speaking to many young doctors or early career doctors and even some medical students, there are many of them that are questioning whether medicine is still the right path, given all the challenges that we face in the medical community. What kind of advice would you give somebody who perhaps finds themselves in medical school, or maybe newly graduated, and thinking about this hat that you wear as the president of the Black Physicians of Canada with regards to medicine? Is it still worth pursuing as a career?
Yeah, absolutely. So it's definitely a career that is worth pursuing, in the sense that we take care of humanity. It's more of a humanitarian service, to provide healthcare to people who need them, to ensure that we have a healthy society. Physicians are an integral part of the system. In the Black Physicians of Canada, it's a Black-led organization that basically exists to unite, to support, and to empower Black physicians and other physicians in training, empowering them to be supported and become highly trained physicians that will contribute positively in the advancement of healthcare here in Canada and beyond. And most importantly, also, we help strengthen their leadership capabilities so that they can also take up leadership role in the communities. So for that purpose, we continue to, provide opportunities for mentorship. And I will say that choosing to be a physician as a career is worthwhile, because right now we do have support systems that would enable physicians, achieve their full potential. And the fact that we do have critical need within the healthcare system in terms of health human resource, there is a need for folks to continue to think about, taking medicine as a career. Yes, there might be its own challenges, but because you are dealing with human lives, you're making decisions in the snap of a finger that will impact an individual or that will impact a community at large. So it's not out of place that you see that the way the curriculum is designed or the way that the medical system is designed for training is as rigorous as it is at the moment. So I will say that for those that are still in training, and for those that have completed their training and in the early stages of their career, that those challenges that are inherent, or those that they're undergoing currently, that there are supports that are available to help them navigate those issues. But there is truly value in pursuing a career in medicine.
And I'm really curious about your leadership history, because it didn't start now in Canada. When you moved to Canada, you've been in a number of various leadership roles. For many doctors, the transition from clinician to leadership that has, especially when it has non-clinical elements or in a non-clinical environment, can be quite challenging.
Absolutely. Thank you. And, it's all about purpose. One defining their purpose. What is the reason for your existence? What value do you want to bring to the table? Why are you a leader in the first case, right? So I say this out of passion. So I have a passion for leadership, and I started my leadership journey even right from my early school days in medical school. So leading our student association and all of that. So my purpose was really to make a positive impact, okay, to make a difference, and over time, I've tried to acquire knowledge around leadership. I've tried to develop my leadership capabilities intentionally, and those uh, 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 situations where I have taken time to study or to, increase my capabilities through professional development centered around either medical leadership or even leadership outside of medicine, have also helped me to understand governance and to understand what leadership really takes. So having that passion to impact life, to create a difference, not just for yourself, but for others, I think that has been my self-motivation and drive. Outside of medicine, there are also opportunities for leadership within the community, right? Because we live and play and grow within a community. So contributing and volunteering your leadership skill outside of medicine is also something that I have valued so much. And I have been very intentional in extending my leadership role to those organizations to build our community. So at the end of the day, my desire is that I will be able to leave my community in a better place than I met it.
I love that your identity extends beyond yourself. Your identity and your influence and your gifts are being shared not only within the medical community, but also in the community where you live. How do you define your success?
Great question. I would define my success as seeing growth that I have contributed to. And by growth, I mean individual growth within my team, growth within my organization, and growth within any area that I have personally committed to supporting, given my leadership role. That is success for me. And at individual level, I've had the opportunity to mentor medical students, mentor residents, and also mentor early career physicians. When they succeed, when I see them taking the next level, going to the next level in their career, that is success for me. My success could also be defined in terms of my family, okay? Because family is central to all that I do. At the end of the day, it's my family that I draw inspiration from. So success for me is, caring for my family, leading with a vision that takes us from one level to another as a family. And that will, of course, be translated into our immediate environment, right? When I see those things happening, when I see things around me changing from not just at individual level, but at a systemic level, and that I'm able to exert some level of influence, because there are great leaders out there that are there are other colleagues that are exceptional, making their own contribution. So I also recognize and acknowledge those efforts. But in my own little way, that I'm able to put smile on faces, that I'm able to contribute to, systemic changes or advocating for policy that would impact lives generally. That is success for me.
Wow, spoken right to the heart of Ubuntu. It is really about not only growing for ourselves, but also how we contribute to other people rising as we rise. So you talked a little bit about your family, and one of the challenges certainly that I see with many physicians, especially in coaching, is the so-called work-life balance or work-life harmony. How do you find time to balance that, but also with your personal life, your family, hobbies, sports, friends? Maybe if you can give us some strategies.
Yeah, I knew the time I mentioned families that you are going to ask that question next. I saw it coming. Yeah, thank you again for that question. When it comes to work-life balance, I think this is something that we have to be intentional about. It's really necessary for everyone to consider work-life balance as something that is of a priority. I have a very busy lifestyle, but I want to give credit to my wife as well. She has been very, very supportive, and I really want to give a big shout out to Justina. She is my pillar. She is my rock. When I'm not there, she gets things going. She fills in. We have a lot that we've achieved together. So I would say first is being intentional, and then secondly, drawing support from your spouse. These are key things that will be very, very important when you want to strike a work-life balance. Above and beyond that, it's not always about work, work, work. Yes, you give and you impact life, but it's also important that you take a moment to recharge, to recuperate, to gas up and fill up, right? And do something else outside of work. I coach soccer and I play soccer. So when I'm not at work, when I'm not doing any volunteer work, I am on the soccer field. So I love coaching soccer. I'm fortunate to be the president of the Prince Albert Youth Soccer Association, and I've been there now for about 8 years as the president. And I've seen kids grow, and growth that I'm talking about is seeing soccer as a tool for positive youth development. So one of the principles that I have is teaching kids that the round soccer ball that you see is not just the soccer ball, but around it are so many things to learn. You learn a sense of responsibility. You learn a sense of teamwork. You learn a sense of taking initiative. Okay. You learn a sense of accountability. Some of these things you may not be taught in the classroom, but on the soccer pitch, we do. And with that, we've seen kids mature and grow over time. And these are life skills that are transferable. And that is what I, draw inspiration from when I go to, spend time with the kids on the soccer field outside of work. Spending time with those kids in the soccer field, that is where I actually have my personal sanity. That's where I draw my, inspiration from to balance my lifestyle as well. It's just very satisfying. It's just very fulfilling when I do that, and I continue to do that as well. And of course, I take time off work as well to, catch up with kids, spend time with my wife, and, discuss, key issues, set goals, and how we're going to get there as a family. And over the years, I've seen that to be quite effective. So that's in a nutshell, what the approach that I take to ensure that I'm also taking time to recharge, recuperate for my mental wellness.
Yeah, and the list of positions is never ending and other activities that you do. And speaking of all these different roles that you have, you are, of course, also the national chair of the Association of Black Conservatives. I'm curious about politics and your outlook and how you are involved in politics.
So my involvement in politics, again, dates back to medical school. I was quite involved in our association politics. And what I actually tell people is that if you don't get involved, if you don't be part of the decision-making process, if you are not part of understanding how things are done and contribute to the narrative, then you are losing out big time. Being involved in politics is something that I have been passionate about. For the Association of Black Conservatives specifically, it's again a Black-led conservative association, non-for-profit, that is basically interested in empowering Black conservatives to participate in the civic process. So we are so big in promoting civic engagement, enlightening Black Canadians on what politics is all about, who are the players, how they can vote and exercise their front, let them know how to run for elections or political offices. So we create that avenue for our Black Canadian communities to be involved. So these are some of the things that I've also been doing outside of clinical practice to ensure that our communities are not left behind. As you know, typically our Black communities don't vote that much. We tend to be on the sideline without getting involved. So one of the objectives of ABC is to really get people to shift their stance and begin to understand how to be involved in politics, because voting rightly and voting for the right candidates, it's also important. So if you don't take steps to learn what is happening, you are more likely to be on the sideline. So that is one of the things that we are currently doing with the ABC as an association.
And how do you, typically doctors tend to stay away from politics. We tend to avoid politics for many reasons. Of course, there's a whole spectrum of political views in the medical community. How important is it for doctors to be involved in organizations like that, whatever their political affiliation or?
Yeah, absolutely. I think I would say, for lack of a better term, that everything is all about politics. There's politics everywhere. We can't deny the fact, and we're all political animals. So even in healthcare, politics is important, and we need to understand how it works. Why? Because for you to bring specific items from the back burner to the front burner, you need to understand how that is done. How do you get your elected officials to prioritize the things that are important in healthcare, right? So that is, of course, politics there. So physicians should also understand how those political processes work. How can they ensure that they hold leaders accountable as well for their decisions? So moving towards elections, we also need to know who are the right players, who are the candidates, how can we work with them, regardless of party affiliation. How do we work with them? How do we sink to their ears what we want them to do as a medical community? The healthcare system in Canada right now is under immense pressure. We have a lot of priorities. So we don't make the decisions. We have to work with the political office holders, provide them with the tools that they need, provide them with the right information, provide them with the data, so that when they're making the decisions around healthcare, they will be seen to be making the right decision. So if we don't understand how those things play out from a political perspective, then we can't achieve our goals. So I would say that even within healthcare, there is a role for understanding politics.
Does that mean we're going to see a Minister of Health in you soon?
Well, I would say never say never. We'll keep going until we see where destiny carries us. But I can neither confirm nor deny that it may happen someday.
Yes, looking forward to it. Anything else that you would want to add about yourself that maybe people don't know about you, that they might be surprised to know about you?
Well, I think something that is important that people need to know about me is that my leadership style is more about being collaborative, being inclusive, and empowering. I love to impact lives. And my goal is that if I meet with you, my goal is not to leave you the same way. My goal is to make you feel impacted in a positive way. And of course, that would also require that, it requires some intentionality. Yeah. So that is my goal. I aspire to influence people. And when I influence people, one thing I say is that it can snowball. You also have an obligation to influence others. And then when we all do that as a community, then our society will be a better place, because it could be lonely at the top. So you don't have to be there alone. And as they say, that a rising tide causes all boats to rise. So with that, I always like to challenge people to go alone. Because if you go alone, it might not be healthy. And again, I always love this African proverb, which is translated in English. It says that if you want to go fast, then you go alone. But if you want to go far in the journey, then you go together. Again, in the spirit of Ubuntu, I'm calling for our community, those that are in leadership positions, those that are up there, to please remember that there are others that they need to extend their hand of fellowship to draw them up.
You're also a director in a board. Can you speak a little bit to corporate governance and why you think it's important for doctors to participate in that?
Thank you. So, within my leadership portfolio, my goal is to extend my tentacles beyond the medical community and also serve on boards where I can leverage on my medical knowledge and leadership capabilities to, again, make a difference in those boards. And I was fortunate to get some support from the John Way Institute, who provided some support to undertake the Chartered Director program, with the McMaster University and also with support from my workplace at the Northern Tribal Health Authority. And going through the Chartered Director program, it actually provided me with a solid foundation in governance that built my confidence to serve as a director on any board. So the ability to ask the right questions on the board, the ability to contribute positively in shaping strategy, developing strategy for organizations, and not just being there on the board because you want to be there, but being there with the sound knowledge and the skill set to make an impact. And it's important that we all do that so that we, again, in the context of equity, diversity, and inclusion, where we are beginning to see some of the sentiments from other spheres, equating EDI as, inferiority. So here we're talking about taking the onus upon ourselves to get the right tools that we need, to get the training so that we are able to compete and make a difference on those tables. So that was the angle that I came with to be able to undertake this program. And then currently I'm serving on the SGI board in Saskatchewan, which I'm very grateful for. And it has also opened doors of opportunity in terms of networking with other directors from other aspects of life beyond medicine.
I'm curious about whether doctors bring any special qualities to corporate governance that perhaps other professions might not. Is there something special that we can contribute to corporate governance as doctors?
I wouldn't say there's anything special, but I think the fact that we were trained to be adaptable, the fact that we're trained to adapt to any situation, so we can fit into any industry, right? Provided that you have the additional training around the corporate governance, train around directorship. What does it mean? How do you read financial statements? How do you monitor progress in a company? So I think it's same. The fact that we already have that training around resilience and be able to adapt, so we can shift that skill across the aisle as well. Having the basic training as it relates to corporate governance is important, so that any board that you're sitting on, you have the right tool, you have the right knowledge to contribute towards the organizational goals, organizational strategies, and priority settings.
So it sounds like doctors are well positioned to participate in boards with the right training. That combination could really add a lot of value to organizations.
Absolutely. That is it.
So Dr. Nnamdi, as the president of an association that represents a wide variety and a diversity of doctors, I'm really curious about your approach to managing and leading multi-generational teams, because in the association, you've got young doctors, the Gen Zs, you've got our generation, the Gen Xers, and older. What are your suggestions or strategies for leading multi-generational teams?
Yeah, that's an excellent question. When I served as the president of the Canadian Association of Nigerian Physicians and Dentists, which is a national organization that serves the need of Canadian doctors of Nigerian heritage. We have over 2,000 members across the country. Again, there are different levels of membership and there are different generational trends. So from residents to practicing physicians, early career, retired. So it's wide spectrum. So one thing that we try to do as an organization is to ensure that we're all inclusive. We identify members within those spectrum or categories that will be involved in decision making. So be it the youth, we have a rep that helps to ensure that we are also bringing perspective, or when we are planning events for the youth, that they are also at the core of those planning. Same goes for our medical residents. They have the ability to make contributions and shape the organization. For practicing physicians, we have same. So being intentional to ensure that there is inclusivity, there is representation, one way or the other, to be able to guide the association to where it's going and achieving its corporate strategic priorities. It's important. That is what we have done and we continue to do. Currently, with the Black Physicians of Canada, we also taking very similar approach. And in the current process that we are taking to do our strategic planning, the wide consultations that are happening both within the organization and outside of the organization is also putting into perspective those different layers to ensure that there is inclusivity, including even the Black medical students. So there is an association called the Black Medical Students Association of Canada, right? So we also work with them to ensure that we have that relationship as the medical students of today are going to become the physicians of tomorrow, right? So there's a need for that collaboration to continue to occur. So with those kind of partnerships, we continue to have a way to synergize each other's effort, not just in terms of membership, but also in terms of a strategy and the long-term relationship that will continue to shape each of our organizations. So we continue to include them in our conversations as well, and they have a rep on our board.
But I like the way that you have given us a very practical example and a practical way of navigating some of these issues and as a leader.
Thank you.
Right. Thank you. That was good.
Yeah, thank you. I really appreciate the opportunity.